All right, today we're stepping right into the X-ray room to look at the incredible precision it takes to get a good image of the lumbar spine. You might think it's a simple thing, right? But getting a really useful picture of your lower back, that's a whole other story. It's actually a pretty complex art, so let's see how it's done.
And that really gets to the heart of the problem. I mean, think about it. Your spine isn't some straight stick. It's got curves, it moves, it's a complex piece of engineering. So how on earth do you get a clear, totally undistorted image that a doctor can actually use for a diagnosis? Well, that's the puzzle we're going to solve today. Okay, so here's our game plan. We'll start with the biggest challenge, then dive into the three main views: front, side, and the tricky angled one. And to wrap it all up, we'll see exactly what makes a perfect X-ray. So, first up, the big challenge. Getting a good X-ray isn't just pointing a machine and hitting a button. It's really about outsmarting the body's own shape to get that perfect shot. And here it is, the main troublemaker, the lordotic curve. Now, this is the totally normal, healthy curve in your lower back. But when you're trying to take an X-ray, that curve can be a real pain. It can mess up the image, hide important details. So pretty much everything a radiographer does from here on out is about trying to flatten that curve. All right, let's get into the first technique. We're starting with the absolute foundation, the AP projection. That's your classic straight-on, front-to-back view. So, right off the bat, there's a decision to be made. Should the patient be standing up or lying down? If you have them stand, it's great because you can see what the spine does under the pressure of body weight. You might see a compressed disc, for example. But if you want the absolute clearest picture of the bones themselves, you've got to have them lie down. Why? Because that's the only real way to deal with that pesky lordotic curve. And when it comes to positioning, every little detail matters. So the patient lies flat on their back, but check out step 2, bending the knees and hips. It sounds so simple, right? But that one move is the secret sauce. It tilts the pelvis just right and helps flatten the lower back against the table, fighting that natural curve. The rest of the steps, that's all about making sure there's absolutely no twisting. Now, let's talk tech specs, because nothing here is random. The central ray, the beam itself, is aimed right at the L3 vertebra, smack in the middle of the lumbar spine. They narrow the beam, or collimate it, so it only hits the parts they need to see. And even the way you breathe is important. They'll ask you to breathe out and hold it. Why? Because that moves your diaphragm up and out of the picture, giving a crystal clear view. Okay, so we've got the front view covered, but that's only half the story. We need to see it from the side to get a sense of depth, and that, of course, is the lateral view. The goal here sounds really simple, but it's actually kind of tough to pull off. You have to get the patient's spine perfectly parallel to the table, perfectly horizontal. If it sags or twists even a little bit, the image gets distorted and you can't see the spaces between the vertebrae. So how do they do it? Well, the patient lies on their side with their knees bent to keep them stable. Now, step 3 is the big giveaway for good positioning. You stack the knees one right on top of the other. That keeps the pelvis from twisting. Then you might need some foam supports or sponges tucked under the waist to lift it up, making sure that whole spine is one nice, straight, horizontal line. But sometimes, even with all those supports, it's not perfectly level. Especially with wider hips, the spine might still have a little sag. So what do? You get clever. You angle the X-ray tube itself. You point it slightly downward, or caudally, to match the angle of the spine. And this is interesting. On average, it's about a 5-degree downward angle for men, and a bit more, around 8 degrees, for women, just to compensate for those typical anatomical differences. Okay, but what happens if that very last joint, that L5S1 spot where your spine connects to your pelvis, is still hard to see? Well, there's a special trick for that. It's called the spot view. It's basically a super focused close-up shot aimed right at that one tricky joint to get a perfect look. All right, time for the most complicated view of them all. We've seen the spine from the front and the side, but some really important bits are still hiding. To see them, we need to get creative with an angled shot called the oblique projection. So what are we trying to see with this fancy angle? We're trying to get a good look at the zygapophyseal joints. It's a mouthful, I know, but these are the tiny little joints that connect your vertebrae together and keep your spine stable. On a normal X-ray, they're all overlapped and impossible to see clearly. And the secret to unlocking this view? It's all about the angle. The magic number is 45 degrees. You rotate the patient's whole body to a 45-degree angle, and suddenly, like magic, those hidden joints open right up for the X-ray to see. But hold on, it's not just about the 45-degree angle. The direction you turn matters too. So check this out. If you're lying on your back and you roll partway up, that's an AP oblique. That shows the joints on the side that's now closer to the table. But if you start on your stomach and roll up a PA oblique, you see the joints on the side that's now lifted away from the table. It's a really clever way to zero in on exactly the joint you need to see.
So how can you be sure you've hit that 45-degree angle perfectly? There's a built-in guide. You look for a tiny little landmark on the vertebra called the pedicle. Think of it like a target. If that little pedicle looks like it's too far forward, you haven't rotated the patient enough. If it's too far back, whoops, you've gone too far. It's a brilliant little visual cue to nail the position.
Okay, so you've done all this careful work. You've taken the pictures. Now, are they any good? This is where the final checklist comes in, the quality control. For that straight-on AP view, it is all about symmetry. You want to see zero rotation. Are those little bumps on the back of the spinous processes, dead center? Are the SI joints on either side the same distance from the spine? And crucially, are those disc spaces nice and open? You also want to make sure there are no buttons or zippers in the way. Now for the side view, the lateral. Again, the big enemy is rotation. And the number one clue is looking at the back edges of the vertebrae. You want to see them stacked perfectly on top of each other, so they look like one clean line. That's how you know you got a true side view, and those all-important disc spaces are open. And finally, for that tricky oblique view, the checklist is all about the target. Are those zygapophyseal joints open and easy to see? Is the joint you're focused on right there in the middle of the vertebra? You also want to make sure the whole column is parallel to the image receptor and that the top few joint spaces are still open. And this quote really just nails it. It's the technical way of saying you hit the bullseye. Proper rotation of the patient is indicated when the zygapophyseal joint is in the center of the vertebral body. When you see that, you know the angle was perfect and the anatomy is laid out exactly as it should be. So when you think about it, it's pretty incredible. Just flattening a natural curve or tilting a machine by 5 degrees, it changes everything. Every single instruction, every tiny adjustment has a massive purpose. It really makes you think, doesn't it? What other medical procedures are built on this exact same foundation, this incredible mix of precision and perspective, to show us what we could never see otherwise?